Welcome back, everyone. Today, we're unpacking an explainer that is, well, literally relevant to every single one of us. We are looking at incorporating inclusion into disaster risk reduction and management, but specifically focusing on those unseen yet massively disruptive health emergencies and biological hazards. When we talk about disaster preparedness, we usually think of earthquakes or typhoons, but preparing for an invisible threat, that requires a totally different framework. And the absolute key to surviving and recovering from those threats? Inclusion, making sure every single vulnerable group is accounted for. Okay, let's dive right in. Here's our roadmap for today. First, the invisible threat, then disaster science and DRM. Next up, inclusive all-of-society engagement, followed by protecting our schools, and finally, mapping vulnerability and risk. So, Section 1, the invisible threat. We're talking biological hazards here. Think about a flood or an earthquake. The physical damage is just immediately obvious, right? But biological hazards, they fly completely under the radar. So picture this totally everyday scenario. What actually happens when a single student coughs in a crowded classroom? I mean, it seems harmless, just a normal day. But look at this through the lens of disaster science. And that cough, it's basically an epicenter of vulnerability. Biological hazards like viral or bacterial infections spread through infectious carriers and human behavior. That single, split-second moment is literally all it takes for a pathogen to find its next host. And what follows is this crazy fast ripple effect. Within days, classmates get sick. Suddenly, attendance drops off a cliff. Then, the crisis spills over into the digital world. Panic and misinformation spread like wildfire on social media. And the real kicker? The most vulnerable people in our communities, older folks, infants, pregnant individuals, people with weakened immune systems, they become highly exposed. It's wild to think a whole community can just grind to a halt from one invisible source. Moving on to Section 2. Disaster science and DRRM. Let's look at how we analyze this vulnerability. To fight something that moves that fast, we absolutely need a solid scientific framework. We can't just cross our fingers and react. We have to analyze and plan. Enter disaster science. It's basically the study of hazard mechanisms combined with a deep dive into vulnerability and risk. It isn't just about studying a virus in a lab. It's about looking at human exposure. It asks who or what is in the crosshairs and why. To figure that out, scientists have to evaluate everything from socioeconomic factors to building infrastructure and environmental conditions. It's a massive, highly interdisciplinary puzzle. And all that analysis builds the foundation for the four main phases of the disaster management cycle. Phase 1 is prevention and mitigation, so things like public awareness campaigns and vaccinations before things go south. Phase 2 is preparedness, auditing medical supplies, setting up isolation facilities, getting communications ready. Phase 3? That's the response, the immediate on-the-ground actions taken during the emergency to save lives. And finally, Phase 4 is recovery, which is all about helping the community rebuild and get essential services back online over time. All right, Section 3, inclusive engagement. This is where we talk about an all-of-society approach. Here's the thing, a disaster plan that only protects the strongest is, quite frankly, a total failure. True resilience requires radical inclusion. Just look at this mandate from the UN Office for Disaster Risk Reduction from 2023. They explicitly stress the full, equal, meaningful, and inclusive participation of women, older persons, persons with disabilities, migrants, and indigenous peoples in all disaster risk reduction processes. That means building policies that are gender responsive and disability inclusive from day one. If we leave anyone behind in the planning room, the entire community's resilience just crumbles. Now, what's really interesting about this is how we define who is vulnerable. We obviously, and rightfully, focus on vulnerable humans, the elderly, infants, those with chronic conditions. But what about our furry friends? Disaster science demands we also look at vulnerable animals. Whether we're talking about beloved family pets, essential livestock, or vital working animals, their lives are totally intertwined with ours. Ignoring their needs in our disaster prep actually undermines the whole community's recovery and health. So, on an individual level, here's what you can actually do right now. Build an emergency kit for your pet. You're going to need extra food, water, and medicine, plus carriers and leashes. Make absolutely sure they have ID tags and are microchipped and registered. And please don't wait for a siren to go off. Pre-identify pet-friendly shelters or hotels today and physically practice your evacuation route. It takes so much of the panic out of the equation when a real emergency hits. Section 4, protecting our schools. Let's look at institutional readiness. We've covered what you can do at home, but what about at the institutional level? Schools are huge hubs of daily activity, which makes them prime battlegrounds against the spread of biological hazards. To tackle this, the Department of Education, or DepEd, established a 4-tiered learning continuity framework. This isn't just throwing darts at a board. It's a highly structured way to institutionalize decision-making during a crisis. It ensures that any response, whether that's keeping a school open or moving to remote learning, is based on the actual specific level of safety and disruption that school community is actively experiencing. And to back that up, guidelines from the Philippine Pediatric Society and the Pediatric Infectious Disease Society of the Philippines hit the nail on the head. They state that decisions for school resumption must always be in full cognizance of the risks versus benefits, with constant re-evaluation. Basically, policies can't be set in stone. They have to be adaptable, they have to be feasible, and they must evolve right alongside the dynamic transmission of the virus in the local community. So when schools are open during health emergencies, they roll out these robust, rapid-fire response strategies. We're talking strict hand washing and cough etiquette, mandatory face masks, physical distancing, even having kids eat meals right at their desks to limit mingling. They pump up classroom ventilation, go hard on cleaning and disinfection, make special accommodations for vulnerable learners, and set up intense contact tracing and isolation protocols. It is a massive, highly coordinated operation to keep everyone safe. And finally, Section 5, Mapping Vulnerability and Risk. Let's talk tech. Okay, so we know the policies and the frameworks, but how do we actually visualize where a hazard is going to hit the hardest? That's where modern tech bridges the gap. Enter geospatial technology. This is the umbrella term for tools that let us collect, analyze, and visualize geographic info. And let me tell you, it's been an absolute game changer for controlling disease spread. By literally mapping out human societies in geography, organizations can collaborate more transparently, instantly route resources, and get help exactly where it's needed during an emergency. So the crucial point here is how we use this tech for vulnerability mapping. This is a GIS, or Geographic Information Systems technique, that graphically shows us which regions are most vulnerable to specific risks. It's not just a basic map. It evaluates the social, economic, and environmental layers that make an area fragile. The whole goal is to spot those high-risk zones early, so we can intervene before a hazard even has the chance to snowball into a full-blown disaster. And the coolest part? This isn't locked away for just government agencies or top-tier scientists. You can actually explore these tools yourself. The source highlights the Geoportal Philippines at geoportal.gov.ph. I highly recommend using this URL as an empowering practical takeaway. Hop on there and see exactly how geospatial data is being used to understand risks right in your own backyard. We've covered a lot today, from how incredibly fast an invisible threat moves, to the science of stopping it, the absolute need to include everyone and every pet in our planning, how schools protect students, and the mapping tools that show us the bigger picture. But honestly, this framework only works if it's actually applied. Knowing how fast these biological hazards spread, I want to leave you with one final, vital question to chew on. What are your own community's inclusive blind spots? Who is currently being left out of your local disaster risk reduction plan? Because at the end of the day, securing their safety is the absolute only way to guarantee your own. Thanks so much for joining me on this explainer, and keep learning.